All right, we're zooming into the community with Serve Connecticut. Serve Connecticut AmeriCorps programs, helping so many people, encouraging volunteerism, giving back to our communities. And I love introducing you to new people with each of our conversations who represent all the good there is out there in the world. I'm Renee Danino, and my special guest today, our superhero, is Celia Meyer. She is the National Programs Coordinator for Health 360, and she's going to tell us about a program with Serve Connecticut AmeriCorps called HealthForward. But first and foremost, hi, Celia.
Hi, how are you?
I'm great. It's so nice to have you here today.
Thank you.
I want to hear all about Health 360, and then we'll get into HealthForward, and then we'll bring everybody else in and how they can be a part of it.
Yeah, absolutely. So thank you so much for having me. I work at Health 360. We're a national nonprofit. We promote health equity in underserved communities with really the vision that all people have equal opportunity to live a long and healthy and productive life. So Health Forward is just one of our programs. So we're talking about AmeriCorps today. Health Forward has been around since 2010 with our partnership with the Connecticut Commission on Community Service, Serve Connecticut. So we have a smaller core, 13 AmeriCorps members that we place across the state of Connecticut. We really focus on reducing health disparities and the impacts of social determinants of health in underserved communities here in Connecticut. And so we do that by having our AmeriCorps members engage high school, college, and health profession students from underrepresented racial and ethnic backgrounds in service learning projects in their communities.
And what I love about what you're saying is I was kind of like looking at some notes as you were speaking, but you mentioned the 13 AmeriCorps members that are a part of Health Forward under the Serve Connecticut umbrella, right? Well, you all were able to do outreach for over 600 people during these COVID times and COVID testing. I mean, 13 people, 600 outreach. I mean, that's incredible. So, congratulations, first and foremost.
Yeah, absolutely. I give all kudos to our AmeriCorps members. We definitely were dealt a difficult hand of cards when COVID came around in the spring. So we ended up having to really be flexible and adapt our programs, and we learned a lot over the summer. And with that, we brought in a new core of members last year in August, and we were involved in some really new, innovative programs that still met the community needs. So we're just really impressed by our AmeriCorps members this year. They've been extremely successful and they've made a huge impact all across the state of Connecticut.
Yeah, and if someone is watching this right now and they want to be a part of AmeriCorps, Serve Connecticut AmeriCorps programs, visit servect.org. I'm going to have a link up as well. This is for all ages. Maybe you're retired and you want to give back to the community, or maybe you're a student and you are looking for some extra credit, or you want to get out there and see what the world is about and truly learn how to make a difference. I encourage people to take advantage of it. Now, having said that, I do want to get back to what you were doing over the summer, because I'm understanding that you all delivered care bags to seniors who were homebound during this COVID-19 pandemic. Tell us about that. That's incredible.
Yeah, absolutely. We had a large emphasis on seniors and especially the impact of COVID and isolation and impact on mental health. We had a couple of different projects going on. The Senior Care Bags was in partnership with South End Wellness Senior Center in Hartford. So some of those care bags were like hand sanitizer, face masks, educational materials on COVID, and then also bags that were more fitness focused with pedometers, exercise bands, and fitness materials. We also had a calling project with the Torrington and Waterbury Senior Centers where we linked up, partnered up high school and health profession students to call seniors in the community. and really just seeing how they were, what their thoughts were, what was going on in their life, if they had needs. So it ended up being really interesting, a great partnership with the senior centers, and something that really will continue on into next year, I'm sure.
So, Serve Connecticut AmeriCorps programs really reach out into the community. If people are wondering, how can you make a difference? One person, just one person. I mean, look at your 13 members, right? Your 13 AmeriCorps members, how much of an impact they made. This is really an opportunity. What would you say to someone who is maybe interested in finding out about the Health Forward program, the Serve Connecticut AmeriCorps program, Health Forward specifically? Is there a certain type of individual that's better suited for this? Younger, older, in college? Otherwise, maybe help direct us a little bit.
Right, absolutely. So we have a really diverse core. I would say minimum requirements are that they have a bachelor's degree or equivalent professional experience. I would say that typically our AmeriCorps members are recent college graduates, although we have had um, retired professionals coming in looking for a different experience, to expand their professional experience. So it really runs the gamut. And I would say most often people are interested in our program because we have a focus on health. They may be looking to pursue some type of health profession or health profession program, medical school, dental school, public health. But it doesn't stop there. Our experience and our program is really varied because we not only have the health focus, but we engage high school, college, and health profession students. So there's the aspect of youth development and education, partnering with the schools and the faculty. And then you also have the community engagement and community development piece. So it's really different, the experience that people might be looking for. And we've had even AmeriCorps members that leave and they go on to law school, or they're interested in public policy. Or even this year, we have someone who's pursuing a master's in museum education once she leaves. So it's very different.
Yeah, it sounds like it, but it also sounds very interesting because you're actually getting to see some of the people who may not be highlighted in the news or in the headlines, the real people of what makes our world tick, right? I mean, the real people that sometimes that get forgotten. And thanks to the amazing work of Serve Connecticut AmeriCorps programs, these people are being served, and so people can make a difference.
Absolutely. I find that when I speak to AmeriCorps members when they're leaving after their 10 months, they didn't realize the relationships that they would build with the students that they work with during their 10 months. They didn't realize the real impact that they would have on community members, and be able to actually see that firsthand. And it makes such a huge difference.
And I would imagine they have impacted those lives as well, because it just really takes one person to change the course of someone's life, right? You have that one mentor, by maybe not even meaning to be a mentor or a role model, just
Yeah.
having someone know that someone else actually cares and gives a what can change the course of humanity, right? I mean, I know that may sound large and dramatic, but it is so, so very true. And it's so wonderful, the work that you're doing, the work that the Serve Connecticut AmeriCorps programs are doing. There's a whole slew of them, right?
Absolutely. And they're all doing great work, and we like to work together in recruitment. There's always a different experience that someone can have in one of the other AmeriCorps program, and it's really all about best fit and what type of experience you're looking for. So we definitely work together in our recruitment process.
So with Health Forward, Serve Connecticut AmeriCorps program, would you say this is also a little bit related to the food and nutrition, and then a little bit about lifestyle? And then do you work closely with other programs? Do you find yourself sometimes consulting with other programs to make sure you're getting what that particular person and or community needs?
Yeah, absolutely. We actually love partnering together if it's an option. So we have definitely worked with FoodCorps members in the past. Some of our previous projects have focused on um, food insecurity and getting students thinking about access to food. We had a member who actually started a garden project at one of her schools, so she directly worked with one of the Food Corps members. We've worked with uh, prevention corps members, bringing training opportunities into some of our students. So there's always a way for us to be able to partner together. Absolutely.
Yeah, from actual physical health and mental health, addiction recovery, food insecurity, as you're mentioning. And then also tell me a little bit about this phone outreach program. Was that specifically designated to seniors, or maybe just it's best if you just tell me what that's all about?
Yeah, absolutely. So that was the project that I referenced before with the Torrington Senior Center and the Waterbury Senior Center. It was originally an idea that was based off of a Yukon Health calling program that was specific to COVID, and reaching out to community members and asking them if they knew signs and symptoms of COVID and how they were doing during the pandemic. And for our AmeriCorps program and our students, we took that model and really evolved it into a senior calling program, and thinking about how it could be appropriate for the students that we engage, and meeting the needs of the senior center and their participants in their programs. So we work together with the senior centers on pulling together the list of questions, making sure it was appropriate, and then the calling of the actual individuals. And we did send out information in the mail to every single one of the seniors at the senior center. And then some of those calls continued on past, the initial one or two calls. And we've had a couple of seniors that have really maintained a relationship with the student as an ongoing, weekly or twice a week call,
Oh, I
checking
love
in to see how they were doing. And we've had some really like great stories of the impact of the program, where we've had some seniors that had some really critical needs that no one seemed to know about. So as part of the calling, it was really identified that maybe there was a need for meals, or there was a need for assistance with medication, or a need to fill out a housing application, where we were able to connect back with the senior center and get those individuals the resources that they needed.
You know what? Also, at the end of the day, a lot of the seniors probably a little lonely, or probably we're looking for some
Absolutely.
compassion and someone to talk to. And my heart just kind of burst when you said there some of them are staying in contact, because just to
Yeah,
know, again, as we stated at the onset of our interview today, just to know somebody cares, right?
absolutely.
What a great opportunity to give back to the community. I really appreciated chatting with you. I honestly didn't even know this part of the Serve Connecticut AmeriCorps programs existed. So Health Forward, right? So Health Forward, if people are
Yes.
interested, you can go to Serve Connecticut, go to servect.org, or directly to you. Can they go to your website as well, the health360.org?
Yes. So our website, health360.org, has a program section, and under there you can find us under Gap Year. You'll see our AmeriCorps program listed there. And then we always are featuring our program and some of the projects that we're doing on our social media. Facebook, it's Health360 Inc., and Instagram, Health360 Inc.
Well, I really appreciate you. I appreciate you chatting about the programs that you're doing, kind of explaining a little bit more about what Health Forward means and what it has meant to so many people here in our state. Please give your team a big virtual hug and thank you from iHeart Communities. We really appreciate you. And want to say thank you to our guest today as we are zooming into the community with our friends at Serve Connecticut AmeriCorps Programs, Celia Meyer, who is the National Programs Coordinator for Health 360. Thanks for being here.
Thank you so much for having me.